functional and integrative medicine practices. My name is Tal, and I'm the educational director at the American Academy of Functional Health. And today we're going to cover how to build a successful practice. I'm going to talk and share with you some of the strategies and share with you some of the legal and ethical considerations. So let's get started. Now, in case you're wondering, this specific training is coming to you live, and we do it live because we want you to be able to take notes and ask questions while we are here to help you advance and build the private practice that you wanted to do, or add have additional income, stream of income. And also, a lot of you are interested in offering functional and integrative medicine. I'm assuming that's why you're here. And so today, we're going to cover how nurses offer private consultations using the functional medicine approach. We're going to talk about important legal and ethical considerations. We're going to talk about some steps. We're going to give you sort of the recipe of how to develop a successful practice and avoid common mistakes that practitioners make that takes them years or makes them lose a lot of money when they're trying to build their own practice. So we're going to teach you the foundation of what it is, how it should be the appropriate way. And then we're going to talk about how to get paid well by doing something that you're passionate about, which is helping patients to get better without relying on more pharmaceuticals, right? Now, in case you're wondering, is this training just for nurse practitioners or a certain type of profession? It isn't. It's mostly geared towards registered nurses and nurse practitioners as well. But in our community, we also have pharmacists, we also have PAs, lots of physicians. We have other professionals like chiropractors, nutritionists. We have lots of health coaches. So most of our community members in the advanced functional medicine program are nurses, nurse practitioners, physicians, healthcare practitioners that are licensed, right? Again, this is live, so take notes, utilize the time we have together. And I also asked one of our lead mentors, Dr. Chill, who helped so many practitioners to build successful practice, to join us later and actually share some of his experience and some of the strategies that he uses to help build successful practices. So just a little bit about myself. Some of you already know me. I've talked over the phone with some of you, and some of you might have seen me teach in some classes. But I've been teaching both patients, the public, students, and medical practitioners functional and integrative medicine for several years now. Probably it's been almost 20 years now, about 20 years now that I've been in healthcare. And I really enjoy it. I kind of started in early 2000, and I got into nutrition and integrative and functional medicine because I was struggling with my own health conditions, and I was just going from one provider to the other. And at some point, I kind of got tired of taking more and more medications. And I also understood, looking at my future, I was like, okay, I'm not heading in the right direction, right? I got to make a drastic change, and I got to change course to, do something different to get different results, right, in my life. So that's what brought me to functional medicine. And since the early 2000s, I've really been investing a lot of my time, effort, and money in learning these methods, bringing them into the clinical application, into the practice, and then also teaching other practitioners on how to do that as well. So, about, I would say, 13, 14 years ago, we moved to Oregon. I met my wife. We moved to Oregon. Both of us spent so much of our money into our education, and right? Anywhere from $50,000 to $200,000, and so if not more than that. So we had a very humble beginning, and when we opened our practice, we can only afford about $600 for rent. So we found a tiny little spot. It was like a corner office in one of the buildings in the downtown, and they agreed to build a little bit of the layout. And I remember calling the landlord and saying, hello, this is Tal. We just signed a lease, and I just want to make sure, because this is going to be a medical office, I just want to make sure that there's a sink. And they kind of told me, well, there isn't one right now, but we'll set it up for you on our expense. And I was like, okay, I was so excited about it. I was so appreciative about that, and because of our small budget. And so this is me looking at the sink when they called me to say the sink is installed. And I came in and I saw that sink, and I was like, okay, is that technically a sink? I wasn't sure, but I was still grateful, right? It was tiny, but it was something to start with. And I kind of struggled in the first few years of my practice. I did everything that my colleagues told me. The first thing was like, you got to enroll with all the insurance companies. So I did that, right? And then I found the dark side of insurance, which is getting higher and higher denial rates, ongoing fighting with insurance, fighting to get what I deserve to get paid, right? If I bill $150, some insurance companies would only pay me $24, right? So it was an ongoing struggle. But I did it. I did everything that my colleagues told me, and I struggled. The first 4 or 5 years were a major struggle. I made multiple attempts, right? I would wake up at 6 o'clock in the morning for networking events. I would go to other practitioners. I would do all that stuff. And I would see patients, but it was a struggle, right? It was a struggle, and I was definitely not making as much as I was supposed to get paid, right? And so that's where I was looking for a different way. And I encountered in a workshop, I encountered somebody, a practitioner that later became my mentor. And over the course of the following year, I came to an agreement with my mentor, and to show me and share with me his systems of kind of showing me how he does functional medicine. What are the processes and systems that he have in place, right? And it was so valuable to me that in 1 year of working with that mentor, I was able to take my tiny practice from $65,000 a year to about $170,000, $180,000 a year, right? So I was able to add $100,000 to our revenue just by adding some of those system strategies, adding a couple of new offers, cash offers into my practice, right? And I'm sharing this with you because I had a lot of resistance to a lot of the things that my mentor was teaching me, right? One of them was, you got to have a cash practice. Like, you got to have a cash service, right? The second thing, and I struggled with that, right? The second thing was, you have to invest in yourself. That's one of the most important things my mentor always used to tell me. You have to invest in yourself. You are the best investment. You are the best investment you can make in your business, right? And so I didn't understand that at first, because I was willing to, and it's strange because I was willing to spend so much money and take so many loans for my healthcare education, but I wasn't willing. I never thought about investing in a mentor, right? And it was expensive. It was like over $10,000 or $12,000 to work with him. But it was all these barriers that I had that kept me from really progressing and succeeding in a way that I wanted. So after the first year, I was like, okay, I invested $12,000 in mentorship, but then I was able to add $100,000 to my revenue. So what if I keep going? What if I hire my mentor for another year? So I did that. And the next 5 years, I was able to hire my mentor, and then I worked with another mentor and built programs and added more practitioners. And I was able to build a very successful practice. We got to about 7 figures, and I was very pleased with that. So we had a nice staff of, we had physicians, we had nutritionists, we had nurse practitioner, we had like a health coach, acupuncturist. We had a kind of an integrative staff. It was great experience, and it taught me a lot. So I'm going to share with you a lot of what my mentors taught me, some of the approach and systems on how to do things. Because if I can give that to you as a gift, then that, to me, I've already done a lot to help you in advancing you, a few more steps, maybe saving you even years of trial and error like I did, right? Or making tons of mistakes like I did. So I first wanted to kind of talk about why are we here? Like, why are we talking about functional and integrative medicine, right? What's the, what are we doing with that, and how can we help patients by using this approach, right? And when I first started, I wasn't sure. I knew that I used functional medicine on myself to find out the root causes of my chronic pain and fatigue. That I had asthma and all the stuff that I had, right? But I didn't know how much I'm going to change patients' lives once I actually bring it into my practice, right? So it's really interesting, because today when I look back and all these experiences, all these faces of the patients that we sat with, they share their struggle, and then 4 months later, 6 months later, we see them and they're doing so much better. Like some of them, 60, 80, 100% reversal of some of their conditions or symptoms. It was truly a blessing, right? I mean, taking somebody who struggled with an autoimmune condition and getting them to a complete remission, it's a blessing, right? Taking somebody with terrible neuropathy or chronic joint pain and getting them 80% relief, and now they can sleep at night and their mood is better, they have more energy. It's a massive, massive transformation. So we still have all these video testimonials of all these patients, and this is one of the biggest blessings that we can have for patients, right? So this is another picture from a tiny segment in the Greater Portland today, where I'm sitting next to Carol, and she's sharing how she was in a wheelchair for several years before she came to see us due to terrible osteoarthritis. She tried everything out there, and eventually it was using these strategies that we were able to help her, the integrative and functional medicine, to take her from being in a wheelchair and being in pain all the time to being able to walk with some support and not having so much pain, right? So it completely transformed her life. So that's why I'm showing you this, because I already know the capacity and the potential of this amazing approach, but I want you to know that you can do so much to help your patients if you learn how to do this right. And then, of course, we applied a lot of those strategies we're going to talk about today, and helping nurses. This is Rose. She's a registered nurse. She worked with us and then developed a private consultation practice. She was doing long shift in the cardiovascular department. So anybody here are nurses who are doing long shifts in the hospital, you probably will know what I'm talking about, where it's sometimes stressful, sometimes it's fatiguing, and sometimes you have that feeling, that gut feeling, that you should be doing something else to help those patients. There's something better that you can do. There's a more personalized approach, maybe an alternative to all the pharmaceuticals they're on. You have that gut feeling that you can do something better, you can do something unique to offer those patients. That's exactly what Rose felt when she came to see us. And we're going to talk exactly how do registered nurses do this? Like, how do they do this while maintaining the scope of a nurse, right? And this is another practitioner, Zerla, who she's a physician assistant. And she wanted to practice independently, do a virtual practice. She didn't want to work as in a primary care setting anymore, and she was also doing shifts on urgent care. And she wanted to do her own private consultations, and we helped her in the same way. Now she charges $200 per appointment, and she's doing very well for herself. You can check out her practice. It's called Thriving with Zerla, and that's an online. She's got a nice website, and she's doing very well. So we're going to talk a lot about different considerations. And of course, just as a disclaimer, I'm not a lawyer. I'm giving you advice. This is really for educational purposes, to share with you how other practitioners are doing this and how you can do this, and in general, work with patients or make recommendations without crossing that line into beyond your scope, right? So that's really important. And also do things right. So the biggest question is, where we're starting in, is why does your community need your guidance? Anybody here wonder that? Like, there's so many primary care practitioners already out there. Like, why would patients need me, right? Anybody here have this kind of question? Like, why would patients pay me, right? Like, what's unique about what I'm doing that patients will pay me for those services, right? Anybody here ask themselves that question? You can put it in the chat. I got the chat open now, so you can put it in the chat. But we're going to answer that question right now, because it's important to know, if you're going to invest time and effort in building this consultation practice, then yeah, we want to know why is it that patients will come to see us and pay us, right? So Lola is saying primary care does not address the root cause. Yes, absolutely. That's way, if we're talking about scope, addressing the root cause is way beyond the scope of primary care or standard of care, right? Matching a diagnosis and matching a drug, right? A pharmaceutical, right? So why would they pay us, right? Let's take a look at why would they pay us. So I'm going to take you back. I'm going to say, okay, root cause, that's absolutely true. But I'm going to take you back a few steps, right? And we're going to look at our biggest challenge right now in the United States. By the way, this is not just in the United States. I'm going to take the United States as an example, but we got practitioners from Canada, from 15 other countries like Europe, Asia, other places. The struggle is very similar, but let's talk about what's going on here in our country first. Currently, 6 out of 10 Americans live with at least one chronic disease. That could be heart disease, Alzheimer's, depression, diabetes, right? So 6 out of 10 have that label and they're taking a prescription, right? Now, how many of these chronic patients are dissatisfied or frustrated? And I'll give you a few options. Option 1 is about 3 out of 10. So let's say about a third of them. Option number 2, about 50% of them. Option number 3, about 7 out of 10. And 4, it's not clear. So anybody want to guess or guesstimate? You can put it in the chat. I'm going to take a little sip here of water while you guys put in the guess. Okay, so let's take a look. What is the answer? And this is from a survey that was done anonymously, so patients feel like they can share whatever they truly feel because it's anonymous. So let's take a look at this. So according to University of Georgia, right, they took a representative sample of Americans age 44 and older. 70% of patients with chronic disease said that they're feeling frustrated, right? Now, there could be multiple reasons for that. What do you think are some of their biggest frustrations of those patients? Did you think about this for a second? Why would most of them be so frustrated with the current state, right? Well, it's really interesting that the number one complaint of patients was feeling tired of describing the same condition over and over again. So I can totally identify that. as a patient, when I used to go to I would go to a practitioner, I would say, I got joint pain. They would say, okay, here's a drug. I'm referring you to the orthopedic doc. I would go to the orthopedic doc. Okay, here, I have joint pain. Oh, okay, well, I don't know what you have, but I'm gonna prescribe you another drug, and then I'm gonna refer you to, and I'm like, okay, and then I refer you back to the primary care. So it's very frustrating when you keep struggling, right? Jessica is also saying lack of being heard by providers, right? Mary is saying the same. They're not listened to in terms of their symptoms, right? So to some degree, we do understand that in the primary care standard of care, right, there's about 7 to 15 minutes, so 7 to 20 minutes if you're lucky, to spend time with the insurance model, right? So it's really hard for practitioners, even if they have such a good heart and they want to give to the patient more, it's really hard to provide the patient the comprehensive approach that they deserve, right? So we do understand that there's barriers in the insurance model that prevents patients from getting the care that they need, right? And second thing is, as you guys mentioned, wishing their doctor had more time to talk to them, right? And then third, having functional limitation, which is really sad. It's really sad when a patient continues to take medication or continues to see doctors or providers, and they lose their health, right? And the classical example is, did anybody ever seen the little bit more advanced rheumatoid arthritic patients, right? When they get to the point where their fingers are bent or twisted or deformed, right? That inflammation has been going on for so long that they lose their mobility, right? And that's really sad, right, to see. So a lot of patients are frustrating. So beyond that, right, the medications that they're taking are expensive, right? So this is a survey that was published, and they found that Americans spend about $1,200 on prescription drugs every year, right? Another one, this is actually quite concerning, right? American boys and girls born in 2019 can expect to spend 48%, about 50% and 60% of their lives, respectively, taking prescription drugs, according to a new analysis. This is a study was published by Penn State University. So this is really concerning because I'm looking at also not just as a provider, as a person that is working in a healthcare field or training healthcare practitioners. I'm looking at that as a father. I'm a father to a 2.5-year-old who's, she's amazing and cute and sometimes, keeps us up all night. But, I'm concerned about, her future. Like if she's going to grow up in a country in which the pharmaceuticals, she's going to be a part of this pharmaceutical. She's going to be on pharmaceutical for long periods of time. I'm concerned, right? Because we know that with drugs sometimes come side effects or loss of function. So that is a concern. So what patients are looking for from you, what they're coming to see you, is they're looking for solutions for their pain, fatigue, loss of function, right? And as you mentioned, primary care provides focus on the disease management and symptoms, right? But your guidance is what's going to help patients to uncover and address the root causes, right? You're going to offer them, you're going to go beyond a 7 to 15 minutes appointment. You're going to go deeper into the root causes, offer more personalized support, right? And then focus on health optimization. So that's completely different than what they're getting over there in the insurance model. And there's lots of registered nurses that are already doing this. This is Jacqueline. She opened up her own private consultation practice. She worked with us, and she said, I've gained wealth of wisdom and feel confident in my teaching to be able to help others achieve true health. And she also received an award, the Great 100 Nurses in Texas, for advancing the science of nursing, right? So we're going to talk some very soon about the scope of practice and how Jacqueline stays within her scope when she utilizes functional and integrative medicine. Same thing with nurse practitioners, right? In some states, nurse practitioner, if you're a nurse practitioner, you have a wider scope, right? That also allows you to diagnose the diseases and treat diseases, which is great. So Larissa came to see us. She wanted to offer comprehensive services. She wanted to have her own private consultation practice, and she also wanted to address multiple conditions from weight gain, fatigue, depression, GI disorders, female hormone imbalances, allergies, and food intolerances. So she wanted to offer more services. That's where we came in and helped her to build a successful practice. So let's take an example of how would you offer functional and integrative medicine services. I'm going to show you the flow, the process, right? And I'm going to take as an example diabetes type 2 because it is the third leading cause of death. And even with all the different pharmaceutical solutions, it's still the third leading cause of death. There's over 230 patients dying every day, that's right, every day, because of the complications of diabetes. So there's a lot that we can help those patients. So patients in most scenarios will get a prescription and sent home. But when they come to work with us, we have 3 different levels that we can help them to get the results that they want, right? And this is taken from a specific training that we have, a workshop that is called the 3 levels of care. So essentially, the way that it works is each level, we're going deeper into more corrective care, right? So let's see how that looks like. Jacob, I think can you adjust this? Oh, it started working. Okay. So when we look at diabetes type 2, on the surface, you might see high fasting glucose or insulin resistance or fatigue, or maybe they develop neuropathy, right? Nerve pain or frequent urination or thirst, right? So you see the pathophysiology and the symptoms of the disease, right? But under the surface, right, what's causing that? What's holding this whole thing under the surface? And that's why we go deeper. And so the first level is integrative management, right? So the patient already comes to see you. Maybe they already have a prescription. Most likely they have a diagnosis and a prescription, right? Maybe they're getting whatever it is. Maybe they're getting also IV therapy or whatever it is, right? The first level of care is integrative management, which means that you can talk to the patient about what herbal medicine or nutritional compounds could be beneficial to support them with this condition or specific symptom. Now, I'll give you an example, right? So if we talk about type 2 diabetes, for example, we know that cinnamon, which is called Cinnamomum cascacea, was found to reduce insulin resistance by activating insulin receptors, kinase, and inhibit dephosphorylation of the insulin receptors. Same thing, another study that found that cinnamon mimics insulin, which allows glucose to enter the cells and activate glycogen synthase, which stores glucose as glycogen. So you can provide recommendation, right, that will help the patient to improve their insulin sensitivity without more drugs, right? So you don't need to get into the diagnosis of the condition or provide a pharmaceutical treatment. What you're doing is educating the patient about the possible strategies. Here's an example of how it looks like in practice, right? So this is a study. This is a clinical trial. They took 60 people with type 2 diabetes. Average age was 52 years old. And for 40 days, they had 4 groups. One group received 1 gram, second 3 gram, and then the third group received 6 gram of cinnamon. The fourth group received a placebo. Now, the result was that all cinnamon-consuming groups reduced their mean fasting serum glucose by 18 to 29% based on their dosage. Higher dosage, typically better results with this particular compound. Even triglycerides reduced, LDL reduced, and total cholesterol reduced as well. And of course, there was no significant change in the placebo group, right? And this is the particular study. It was published in the journal Diabetes Care, so you can read more about that if you want to. But here's a simple example of educating the patient, right, to, when appropriate, take 500 milligrams of cinnamon in the morning, 500 milligrams cinnamon in the evening, right? So we're following evidence-based protocols, and we're educating the patient about something that could be beneficial for them, something that is more natural with less potential for side effects than taking a medication, right? So we're talking about integrative management because we help to manage the condition in a more natural way, and that also helps to promote healthier function. Next is the next level you can go work with your patient is the proactive wellness, where we change patient's diet or lifestyle to anti-inflammatory. So what would that look like? The patient comes to see you. Let's say they pay you $150 or $250. Typically, most practitioners in our community will start at $150 or $200 per consultation, which is about an hour. And you'll educate them about maybe one or two principles of the Mediterranean diet, right? So Mediterranean diet, very specifically to type 2 diabetes, the principles are higher consumptions of fruits and vegetables, legumes, nuts, whole grains, and olive oil, right? So it contains a high ratio of monounsaturated and to saturated fats, right? And lower intake of trans fatty acids, higher intake of fiber, vitamins, minerals, and antioxidants. And there's some really cool studies that show that the principles of the Mediterranean diet support healthier weight, reduced risk of cardiovascular diseases and related mortality, and improvement in glycemic control and insulin sensitivity. So again, we're using simple strategies to educate the patient how to self-care. And here are the multiple studies you can look into that specifically showing the Mediterranean diet principles and diabetes. So this is, again, patient comes to see you. They're going to get strategies that they're not getting anywhere else to actually improve their health and function. And this is the third level, right? The third level and most deepest level, and I refer to it as the correction level, which is educating the patient about what it is that it's actually causing or contributing or triggering their disease. This is something that for me, after years of struggling from chronic pain, inflammation, asthma, fatigue, right? It completely transformed my health. When a practitioner sat down with me and looked at my lifestyle and looked at the foods that I'm eating and look at my exposure and look at everything around me, right? And educated me about these factors, the things that I'm doing to myself to trigger my condition, that was a game changer for me, right? That's where I was able to slowly, with that practitioner's guidance, slowly adjust my diet, adjust my lifestyle, and as a result of that, I'm not taking any pharmaceuticals for years. I don't have that inflammation. I don't have pain. I have a lot more energy than I ever had before. So this is really why it's so meaningful and so important. So what would that look like? There's multiple factors we go into in functional medicine, right? There's multiple. From gut to environmental factors to our diet to our lifestyle to multiple factors. But I'll give you an example of one simple that is hormonal, and that's the HPA axis, the endocrine imbalance in type 2 diabetes. So in our circadian rhythm, we have our HPA axis, which means hypothalamus, pituitary, and adrenal. Essentially, every time they in a normal function will have higher cortisol in the morning secreted, and then it slowly reduces throughout the day. Now, cortisol elevates your sugar level, right? I'm not going to get into the mechanism too much right now because that's not the class we're having right now. But essentially, essentially what happens is every time you have cortisol secretion, if it's normal or if you're stressed and your body secretes cortisol, your sugar level goes up, right? There's a process in your liver that is called gluconeogenesis. Cortisol goes in your liver and stimulate your liver to start releasing sugar, right? Glucose. So it elevates your glucose level. So this is really interesting. There's actually a specific study that found that in some individuals, their HPA axis is dysfunctional, meaning that they secrete cortisol in the evening or at nighttime. And guess what that does to their sugar level? Elevates it. So they don't have to eat sugary stuff or carbs at nighttime. Their sugar level might increase by itself. And so this is really interesting. According to an article published in the Journal of Clinical Endocrinology and Metabolism, high evening cortisol levels were predictive of new onset type 2 diabetes in a study, as I mentioned, that was published. And so this type of information is not talked about in the primary care setting. So how do we identify this, for example? If the patient have anxiety, that's one of those symptoms. We know anxiety triggers the HPA axis imbalance and vice versa, right? Patients that have anxiety or depression, a lot of them have HPA axis imbalance or dysfunction. If they have fatigue during the day, that could be their cortisol drops. If they wake up or have insomnia, that's sometimes another symptom, right? So we learn the signs and symptoms, how to identify this, and then we talk to the patient a little bit about their experience during the day. And then there's also a lab test that the patient can order for themselves in most states. Patients in our country, patients can just go online, order this saliva test, and measure their cortisol levels 4 times a day, right? From the time they wake up to the time they go to sleep. Before they go to sleep, they can put in the saliva sample, put it in a lab kit, and ship it in the morning to the lab, and they will get a very specific levels of cortisol. And that gives you, the practitioner, the full view of what's going on there with their HPA axis function. So you don't even have to order those labs. Patients can order those labs for themselves. But this is really important because if we don't find a root cause and we don't do corrective care, we can help the patient with integrative solutions or nutrition or lifestyle medicine. But if we don't address the root cause of your health concerns, it's going to be hard to fix it and provide a long-term solution, right? Now, also, excess of cortisol was also being demonstrated to lead to diabetes or worsen metabolic this syndrome, as I mentioned before. So let's talk about offering functional and integrative medicine consultations. So, and again, this is everything that I'm showing you is really a part of why the major reason why patient comes to see you as a functional or integrative practitioner, right? It's because you're going to deliver results that they're not going to get anywhere else. First of all, you're going to educate them about what they are doing to their body to trigger or contribute to the disease, right? So they understand why they're sick. That's really important for patients to understand why they're sick, right? Beyond genetic and old age, right? The second thing is, what do I need to do? Like, I'm here, I'm struggling. Like, what do I need to do? I keep going to my provider, they keep giving me more drugs. Like, what do I need to do that is not more drugs, right? So this is an example of Gina. She's a nurse practitioner who was working in a hospital in the oncology department, and she wanted to help her patients. In our conversation, and you can listen to our conversation on the website, we got our conversation recorded with her, and she said, patients were asking me questions like why they're sick, or what do they need to do about their nutrition or lifestyle, or if there's supplements they can take. And she didn't have the answers, and she didn't like not having the answers, right? So she came in, she started working with us, she went through our program, and she learned from the Advanced in Clinical Functional Medicine program, and she started a tiny little practice. It was like maybe 1 day a week, It was like a small room inside a different practice that she rented. And within a few months, with some guidance and mentorship, she was able to transition to a full-time in her practice. She's very successful. She gets paid about $800 per appointment, and she's got a 3 months waiting list. So now we are training 3 more nurses to join her practice. So I'm showing you this because it's possible. It's possible for each one of you to have a practice, a consultation practice. You can check out her practice is Allied Wellness Solution, and she's doing very well. So nurse coaching, let's talk about important legal and ethical consideration. How would you offer? What's the process? I'm going to give you the exact process and which tools are available for you to use that. And by the way, if you want our checklist, our new practice checklist, which has all the different vendors you can use, where do you get your insurance? If you're a registered nurse and you want to do what we call nurse coaching, right? Then where do you get that insurance? What EMRs can you use? Like all of that stuff, we got a new practice checklist. So just reach out to us, put it in the chat that you want the new practice checklist. We'll send it to you in an email so you can have something you can get started with. So nurse coaching, it's important legal and ethical consideration. So this is the flow, and I'm gonna really simplify it. And so this is the clinical framework. So we're always starting when a patient schedule a consultation with you, like let's say a review or a session, right? That could be, by the way, virtual. So I showed you Rose, the nurse. So Rose is in Colorado, and she didn't want to open a brick and mortar practice because she didn't want the overhead expenses of rent, a receptionist. She didn't want to deal with any of that stuff. So we showed her, Dr. Chill showed her exactly, and myself showed her how to start with just a laptop and internet from home. So that's what she did. So patient goes and meet with you either virtually or in person. You do a review. You look at the medical history. You look at their lifestyle, occupation, what they eat, what they drink, all of that stuff, right? Major concerns. From there, we use tools like the functional medicine evaluation tool to identify what are the triggers or root causes, right? Let's call them root causes. So the evaluation tool is very simple. You just give it to your patient and you say, fill it up, and it has categories, and each category is like one root cause. So we got HPA, symptoms and signs of HPA imbalance. We got symptoms and signs of heavy metal toxicity, gut dysbiosis, loss of integrity of the gut. That could be endocrine disruptors that the patient is absorbing or breathing in, right? That could be multiple things, hormonal imbalance, different types of hormonal imbalance, neurotransmitter imbalance. So we got essentially it does the heavy lifting for you. And once you look at that results, so before the patient comes in, you just look at the results for like 2 or 3 minutes. You go over the patient, you go over it and say, okay, here are the top 1 or 2 root causes that I would want to focus on in the next 30 minutes, right? Ask more questions, and if needed, then let the patient know that they can order their own labs that are recommended, right? Now, if you're a nurse practitioner and you have a full scope, then you can probably order the labs for the patient. But if you are a registered nurse, and we're going to talk more about that very soon, then you will let the patient order their own labs, and we'll show you where the patient can do that for themselves online, and they don't have to even go anywhere. Today, most of those labs are shipped to the patient's home, where they can fulfill the sample at home and just call FedEx, and FedEx comes to pick it up. So it's super convenient for patients today. They don't need a blood draw and all that stuff. So from there, and by the way, the evaluation tool, when you're in the program in our community, you get lifetime access to all of the clinical tools that I'm showing you right now. Now, the health plan is that's where you create evidence-based plan using diet, supplements, lifestyle changes. So you might ask yourself, well, Tal, where do I get those evidence-based protocols? So one, the Quick Start Guide has all the specific protocols for the root causes. So if a patient has gut bacterial dysbiosis or candida overgrowth or loss of integrity or exposure to heavy metals or whatever it is, then you have specific protocols with specific information about where are those labs to consider, where do we get them, and all of that stuff is available, including which supplement, professional grade supplements they can consider. So that's all provided to you. And then the phone app is really cool because the phone app has the functional medicine phone app that the Academy developed is amazing. All you gotta do is open your phone and say, oh, you got type 2 diabetes? I type in, okay, type 2 diabetes. And then it pulls up all the treatment protocols. Oh, you have arthritis, headache, PCOS, whatever it is, I'm just typing in the app and it gives me all the treatment protocols, including the specific dosage, the specific compound, what's the indication and contraindication, and it also tells me which supplement I can find that compound that was used in the research. So really cool. You can build a treatment plan in like 5 to 10 minutes with all of those tools. And currently, when you enroll in the Academy, you get 3 years of the phone app on us, and then you get lifetime access to all the other clinical guides and evaluation tool, all of that lifetime access, and then educate. From there, you see your patient every 2 weeks to provide, they give you feedback, you provide them another recommendation or adjustment to their diet, another recommendation of supplement, another recommendation maybe to something in their lifestyle that can be better, right? So we give you all the treatment recommendations. And for you, it's just you put in it and you personalize it for each specific patient based on their unique needs and, of course, physiology, how their body works, right? So this is why they need you, because they are not going to get this in any practitioner out there that does primary care or use the insurance model, right? Which is a 5 to 15 minutes. Here's a prescription, you're out the door, right? So here we're very invested in our patient's success, and we want to equip them with all the tools that they need and strategies that they can be successful, right? Your patient's success is your success. It's also your reputation, right? And the only way that Gina can go up from like $200 to charging $800 is because she has amazing tools and amazing strategies that can provide amazing results for her patients. So that's what we want for all of you. So you don't have to. Sometimes we get asked, Tal, do I need to invest like 2 years now or 3 years now into studying functional? There's a lot of patients out there that need your help, right? So there's a lot of patients that 2 years from now, they're probably going to be in a way worse shape than they are right now. So why not help them? Why not you, right? So we develop all those tools together with guidance and mentorship on how to case studies, and we have workshops that we do sometimes on Saturdays, live workshops when we build a treatment plan, right? We have all of these tools because we want you to start offering consultations within a month or two, right? We don't want to pull this over 2 years, right? It's like you have a vision, you have this passion in your gut, you have this gut feeling that you should be doing something more for your community. That's what we develop the tools to help you get started. And when we talk about scope, this is really interesting, right? So nurses, this is according to the American Journal of Nursing. This was just published last year. Nurses are well equipped to educate patients on functional medicine concepts and the patient's role in promoting their own well-being, right? Educating patients on the interconnectedness of lifestyle, genetic, and environment can empower them to take active role in management of their health. So Notice that nothing that we have said here is focused on diagnosing a disease or treating a disease, right? None of it. That's not what we do in functional medicine. What we do is we educate the patient about strategies to improve their health and function. That's all we do, right? It's simple, but it's so powerful. And so this is really important when it comes to the scope. Functional medicine is not and does not replace primary care. So even if you are a registered nurse, you just need to tell that to your patients. Like you tell them, I'm a nurse. I'm not doing primary care. I'm not practicing medicine. You need to keep your relationship with a primary care practitioner so they can manage your diseases, they can manage your prescriptions. I'm here to help you improve your health and function so you can feel better, you can function better. That's my role here. Now, by the way, even if you're a nurse practitioner for the full scope, I would still highly recommend that when you do functional medicine, you have a disclaimer that tells this to patient that functional medicine is not standard of care. We're not prescribing medication. We're not diagnosing diseases, right? As I mentioned, not designed to diagnose, treat, or cure diseases. It is there essentially to find, and we use it as an approach to help patients find the root causes and educate them on how to remove or reduce exposure to triggers or dysfunction. And of course, we do a lot of empowerment of the patient and guidance throughout the way. And if you think to yourself, well, that's crazy, Tal. Will patients really pay for that? Yes, they will. I mean, our nurses in our community, they get paid between $150 to $800 per session. In my practice, it was very similar, only I was working mostly on payment, on like a plan. So we had like treatment plans, and the treatment plans in my practice ran between $5,000 to $12,000, depending on how long they want to work with me or somebody in my staff. But again, we're using the same tools that the academy gives you. Like I took the tools from the academy, right? I took the tools, I built a functional medicine, diabetes, and neuropathy program, and then I was sitting with patients, educating them every 2 weeks, spending an hour educating them about how they can take care of themselves. They come back 2 weeks later, they tell me how they feel, what changed, what struggles they have. We change, we modify, and then they slowly get better. 3 months into it, they order the tests again, either from the primary care or they ordered from the functional medicine vendors online. And then from there, we continue to work, right? That's how we get them results. Patients need your guidance because they're not going to get this anywhere else. And again, our program it's online. You get 24/7 access to everything. All the herbal medicine, clinical guidance, functional labs, nutritional supplements. You learn the entire system in the first 3. Just do one module in a weekend, which is 2 to 5 hours. You can 3 or 4 months, you can finish the entire phase 1, which is the entire functional medicine system. And of course, coaching is important. The phone app with all the protocols are really, really important as well. And of course, we always use collaboration, right? Because we understand that what we do is a holistic, patient-centered approach, right? So if a patient there's something that they need to go back to their physician, to psychologist, dietitian, physical therapy, whatever it is, we understand that it's not about us, it's about what's best for the patient. So that's a big part of it. And again, as I mentioned, this is again from the American Journal of Nursing. Functional medicine aligns seamlessly with holistic nursing philosophy. So you can read more about it in the American Journal of Nursing, but this is now referred to as holistic nurse coaching for registered nurses. And there's more and more nurses that are coming to see us. Right now, I think our program is a little bit over 50% are just registered nurses and nurse practitioners, which is amazing in my opinion, because when we first started, most of them were physicians, but in my opinion, nurses and nurse practitioners are best trained and most experienced when it comes to educating and guiding the patient. Maybe it's because you guys spend the most amount of time at the bedside next to the patient, explaining to the patient what's wrong with them, what's going on, what are their labs saying, right? Because the other medical professionals, most of the time, they don't have time to do that, right? So that's where we want to help nurses and nurse practitioners to do the same thing using the approach of the functional integrative medicine, but privately, so they can earn more. They can earn 3 or 4 times more per hour than they work in a hospital, right? And have more freedom. So that's really our passion. So I wanted to talk about the 3 critical mistakes, and then we'll bring in Dr. Chill. So this is really, really important. I'm mostly going to focus on 2 critical mistakes. And if we have time, we'll talk about the 3rd. But mistake number 1 is letting your own or others' limiting belief hold you back from achieving your dream. And I say that because I personally struggle with this, and coaching other practitioners, I saw how many practitioners out there struggle with the same issue, right? And this is something Tony Robbins said it multiple times. If you raise your standards but don't really believe you can meet them, you've already sabotaged yourself, right? So there's multiple reasons why there are limiting beliefs. And this is a part, again, why a mentor is so, so helpful. Because my mentor helped me in the first 2-3 months. My mentor helped me a lot overcoming these limiting beliefs. And what I found out, that in my life, not just in my practice, but in my life, the bottleneck, right? The bottleneck was me. I was the bottleneck in my life. I was preventing from good things to come into my life because I didn't believe that it's possible, right? And I'll give you an example. Who here has, for example, the belief that patients will not pay out of pocket for healthcare services or products? It's okay. You can put it in the chat, right? I can admit it in front of all of you that I had that problem. I struggled with it for a long time. Anybody here have this thought? You can put it in the chat if you do. I'm going to take a little sip. This is, by the way, why I kept working with the insurance, even though I don't like to use the term I would get screwed over all the time, because it's kind of rough to say that. But the reality of it is that when you work with a patient for an hour, you provide them great guidance, and then within 3 or 4 months, their diabetes number, hemoglobin A1C, drops significantly. Their neuropathy drops significantly. Like their autoimmune condition goes into, their symptoms improve or go into remission within 6 months. And then you bill for $150 or $180 and you only get $35. It is very, very frustrating, right? And these negotiated fees, in most of the cases, there's nothing you can do about it, right? And sometimes patients come to see you and they cry and they want your help and their insurance denies care. So this is a big one, and I wanted to talk about it because I also saw that some of you in the chat have posted that you have that belief too, and I'm going to show you some interesting statistics, right? So this is a survey that was done by the National Institute of Health and the CDC survey, and they found that 1 out of 5 U.S. adults had at least one out-of-pocket expenditure on complementary health services. And that includes, in total, in 1 year, about close to $15 billion on complementary practitioners nationwide, $12.8 billion on natural product supplements, and $2.7 billion on self-care approach, right? So we know that 1 out of 5 statistically chronic patients that you are seeing are seeking some sort, are actively paying for some sort of like complementary services, right? Whatever that is. And it's out of pocket, right? A lot of it, by the way, is functional medicine. Some of it is acupuncture. Some of it is chiropractic. Some of it is nutrition. Some of it is supplements. I saw a lot of patients on Social Security that take multiple supplements that are hundreds of dollars. And then what about, they're not even counting the folks that go to, what's that name of that place where people pay like 3 times more for the organic vegetables and fruits, right? 3 times more for similar vegetables they can get cheaper other places, right? Or other products, right? Or grass-fed beef or chicken, right? That sometimes costs twice as much than a regular one. Whole Foods, right? So if you walk into Whole Foods, a multi-billion-dollar chain, right? Most of the people that are there, they pay 2-3 times more because they understand the value of investing in their health. So, these patients are out there, right? These patients are out there. Statistically, 1 out of 5 will pay for complementary medicine. Let's take a look at how many people spend on supplements. So this is according to another survey published in 2018. They found that about 86% of adults, Americans, take supplements. So about 4 out of 5 adults that you know are taking supplements. That could be multivitamin all the way to herbal medicine. A lot of patients, by the way, go home and they ask Dr. Google, what should I take for my neuropathy? What should I take for my fatigue? What should I take for my headaches? What should I take for my menopause symptoms, right? So if you just go and do a little experiment and you type on Amazon, on a search bar, you type in pain supplement, you'll find hundreds of products with thousands of reviews, right? So a lot of patients are using those and they need somebody to give them evidence-based guidance, again, because there's nobody else that they can talk to about this stuff. So I just wanted to show you this, right? Now, of course, I didn't even include here the amount of patients that pay for like cosmetic stuff, like liposuction and all that other stuff, right? Patients pay for what they value. That's just the reality of it. And our job is to first show them the value, right? So there's multiple ways to do that. We're not going to get into it today. There's a whole class, it's called The Secret of Successful Consultation, in which we share all of that with you. But the idea is that what you're offering, and I'll give you this script, right? What you're offering is something that no other practitioner offers in the insurance model, which is you're going to educate them about why they're sick, what's most likely causing them their symptoms or trigger or contribute to their symptoms, and then strategies to regain their health, right? Mistake number apparently 32. Apparently we got to mistake number 32. Not investing in systems and yourself to learn how to achieve your goals. This is a big one. So once we overcame this belief of like patients won't pay, right? Again, as I mentioned, this is really important. Why is this important? Because if you think about it, if you are a patient, if you're somebody who struggles with back pain, headaches, neck pain, arthritis, terrible digestion problems for now 5 years, right? It's starting to interfere with your mood, with your relationship. You're starting to wonder how you can keep your job with all this struggle. And you now hear about a new approach that can help you improve your health, improve your function, and feel better, but it costs $1,000 or $500. Would you pay that if you can get that money? I would. I can tell you I would, and I have been to functional medicine practitioners to help me resolve my own problems, right? So I would pay thousands of dollars, because I can tell you I tried for my chronic pain. I saw a chiropractor for several years. I tried acupuncture for several years. I did physical therapy. I did injections, and I paid thousands of dollars just to manage my condition. And when I heard there's an approach that can help me figure out why I'm sick, I knew that I'm gonna figure out how to make that happen, even if it's more expensive than I can afford, right? So corrective care, think about this, corrective care, that's where the value is. Okay, so mistake number 2, it's supposed to be mistake number 2 and 3, but it's not investing in systems. So in terms of our training, this is really interesting. We invest so many hours, hundreds or thousands of hours in training, right? We get the theory, we get the clinical, we get the internship, we get to work on patients when somebody's watching us and helping us and guiding us, right? It's like 99% of our effort, time, and money goes into the medical training. But how much of your time, effort, and money actually went in to learn functional medicine, learn how to promote your practice, operate your practice, get clients in? Like, how much of that, learn the process, get the clinical tools, like how much of that actually you invested? Most of us have not, right? And that's the reality why so many practitioners are struggling. And so this is where systems and personal coaching and mentorship is the most important part of being, right? My practice transformed when I started implementing the functional medicine evaluation tool, because it saved me hours, right? My practice started transforming where I started using the clinical guides and tools. And then most importantly, my practice really transformed when I had somebody experienced that already built multiple practices, and they were able to guide me towards, oh, this is where you are. To get to the next level, these are the steps that you need to take. You do this, you do this, you do this, and then from there, we're gonna go to the next step, right? Exactly in the same way that patients pay you for your guidance, I paid my mentor for their guidance, right? So that is so critical. And I wanted to share with you one of our community members, Susan, who is a nurse practitioner, and she went from having like no experience and no clients. She was working in a primary care practice, and she went within a few months to building a successful practice with recurring revenue through memberships. She worked with Dr. Chill, who's kind of come in right after her, and share a little bit and how we helped her to build a successful practice. So here's Susan, and my conversation with Susan, sharing how she built a successful practice.
I was in traditional medicine for almost 20 years, and then I got out of that because I didn't like seeing my patients not getting better, and I kept trying to lead them, natural ways, diet, lifestyle, but I didn't know what to really tell them. They don't teach us that. Everybody was just kind of treading water, and nobody was getting better. Some people were getting worse. All I was doing was managing medications. There was not a whole lot of time to do anything else. And I worked in primary care, and I worked for a health center. So we took care of patients that were insured, underinsured, and uninsured. And all I could do with these people was throw medications at them that weren't working and weren't doing anything, and they were just not getting any better. And I couldn't continue to just be in that. I had to branch out. I needed to do something different. So I got out on my own and was kind of still dabbling in primary care. And then some of my clients, some of them were saying, hey, I want to do something more holistically. This is what I want to do though. And so I made it happen last year. I didn't really necessarily have the means to do it. Oh yeah. vast majority of my clients get better and get better quickly, and that's the biggest foundation. I always, just harp on that. This is the foundation of everything we do. If this isn't good, then nothing else will really work well as we keep going. So they do all get better. It's so amazing, and I just love the feedback from them. They're just so happy that they came and found me. They're so happy that they feel better. Even a lot of them who weren't complaining of feeling bad, that just wanted to maybe lose a little bit of weight, or just make sure that their health is good for their kids, or whatever the case may be. And then down the road, they're like, man, I didn't realize that I wasn't feeling well. I feel really good now. Thank you so much. And it's just, I love hearing that, because I wasn't hearing that in primary care. I wasn't hearing that, oh, I'm getting better, I feel great, oh, my energy's great, my sleep's great, all this stuff. And now, it's amazing. And and it just took off. I started getting client after client, and then this spring, that passed, it just blew up. I've just been very, very busy. I had to hire a health coach. So it's just been crazy, but awesome all at the same time. A lot of people are done with their traditional doctors. There are very many people that aren't, because that's what they know, and it's hard for them to change. But there are a lot of people that are just tired of feeling bad, and they're ready for, to feel better, and they know that this is a better way. So I do an initial consultation that's $300. If they decide to move forward with me, my membership's $313 a month. Some of them actually pay up front. I do have a few people that pay the whole year up front, and they do get a little bit of a discount off that if they pay up front. I picked your program because it was very application-based. So I knew that the way yours was described when I was looking into it was that you can take yours and you can start right away. You're not going to really have to go through months and months and months and months of education before you can really apply it to what the patients you're seeing. Yours was very applicable from the get-go, which is what I was looking for. I wasn't looking for, and I didn't want to go through IFM. They were just, it looked like it was going to be long and drawn out, and I didn't know when and I needed to get started now. But so we had to really kind of hit the ground running, and your program I was able to do that. Knowing you had that coaching available with a functional medicine practitioner that seasoned and could help go through cases and answer questions and give me the support, that was absolutely essential. That too was probably one of the other big reasons why I chose your program over another program, is just having that. That is so important. If you didn't have that, I don't think I would be as successful as I am. It would have taken me a lot longer to get to where I am. And I think that even, some of the very most successful business people have a mentor or a coach to help guide them through their business stuff. So it's super important. It's important for everybody. Everybody needs to do that.
Wonderful. Well, it was good seeing you. Take care in the meantime, and have a wonderful weekend.
All right. Thanks, you too.
Thank you. The reason I wanted to share this with you is because when you utilize the clinical systems and strategies together with a mentor that coaches and guides you throughout the process and shows you how to apply everything you're learning, show you how to make sure that you're applying everything in the right way, you're structuring your practice in the right way, you're doing things in the right way, then that helps you to avoid a lot of frustration, helps you to avoid critical mistakes that can cost you time and money. And I wanted to bring up Dr. Chill, the lead medical coach who has helped so many of the practitioners in our community, registered nurses, nurse practitioners, physicians, PAs, pharmacists, to build a successful practice. Dr. Chill has years of clinical experience. He built 2 brick and mortar functional and integrative medicine practices, and built virtual practice and virtual programs for patients across the nation. So he's got lots of experience. And beyond all of that, he also has an MBA and a doctorate. So I wanted to bring Dr. Chill. Dr. Chill, It's good to see you.
It's great to see you, Dr. Cohen. Good evening.
Yeah,
Thanks
good
for having
evening.
me.
Thank you so much for joining us today. I really appreciate it.
It's great to be here. Hi, everybody. Hope everyone's having a good day or a good evening.
So I wanted to have Dr. Chill join us to share a little bit of his experience. We know that there's a lot of hesitation with practitioners when they're first coming in to this, going into this field, because they're, some of them are unfamiliar. But Dr. Chill is very experienced, and we've seen the results of those practitioners, which is the most important, is seeing the results of what happening. So, Dr. Chill, you want to share a little bit, and then while you do that, I'm gonna draw the funnel, which is sort of the foundations. We can talk a little bit about that as well.
Yes, absolutely. So, I mean, a couple of the biggest concerns that many practitioners have when they are first coming into this program is, one, how to apply all of this information that you're learning, right? There's a plethora of information, and it's a different approach than what most practitioners are used to. So there's this clinical application side where we go through on a day-to-day how you would use functional medicine, right? We would go through guiding you in how to bring in functional medicine, utilizing the tools to figure out and assess what the major underlying factors are, what the underlying root causes are. And then from there, how you would assess the labs. And then from there, where to start with treatment approaches. And then from there, how to follow up with your patients, what the visits look like, and how to monitor your patients. We go through all of that in the clinical side, right? Because one of the biggest ways to become a great practitioner and to build your business is to be really good at what you do, right? And you're going to have a big referral system. Suzanne, the nurse practitioner that you saw earlier, one of the ways she's building her practice is being a great practitioner. I was overseeing the majority of her cases. I was meeting with her on a weekly basis, not only for business stuff, but also for the clinical side of everything. So that's one side of the program. The other concerns that most practitioners will have is they're coming from an insurance base. So they're concerned that their patients won't pay cash for their services. What they're not understanding, and we typically go through this aspect in the business coaching sessions, is they're going after a different demographic, right? And a lot of times the people who are utilizing insurance, they understand that perspective and that approach, and they usually stay within the insurance base. Every now and then you might get those types of patients that will switch from the insurance base because they're really, really sick and they just need to go into the functional medicine side. But when we're talking about business, a lot of times it goes into a different market for the cash paying side, right? We're going into assessing the root cause and figuring out what's happening with them. And when I start to go through that aspect with a lot of the practitioners, they start to see the light bulb, and then we go through what they should be charging. And when I start working with practitioners and they start building their practice, they start charging those prices. And then in the next visits, they'll come back to the coaching session and they'll say, I didn't have a problem with those patients paying those prices, either for their one-on-one visits or their packages or their memberships. Many of the times, the patients don't have a problem with that. So those are a couple of the concerns where they're coming into this program.
Yes, absolutely. And I can share that, as I mentioned before, I used to struggle a lot when my mentor used to tell me, Tal, you need to, increase your rates, or you need to charge more, you need to have. And what I found over the years, of course, working with a mentor was was critical for me to actually continue and be successful. What I found that later on is that price for who came in and understood that they're not getting the answers they're looking for in the standard of care. They definitely don't want more medications. I used to hear that all the time from patients. Like, I'm not going back there. I don't want more drugs, all that stuff, right? But what I understood is that pricing was not the issue. To me, and this is how we train a lot of our practitioners in our community, is that the most important thing when you're working with a patient in front of you is making sure that you are a good fit for them. They are a good fit for you, meaning they are willing to commit the time and effort to make those changes that you are going to tell them. And of course, with most of them, they already there, right? Because if any of you struggled for years with back pain, neck pain, you can't sleep at night, you're moody, or you got digestion problems, or you got an autoimmune condition, right? And you're inflamed all the time, you understand that you just can't continue to live life like that, right? In this misery, this 24/7 misery, right? So patients understand already, a lot of them, as I showed you in the statistics earlier, 70% of chronic patients are frustrated with that insurance model. They're looking for something else. So yeah, it's not, like Dr. Chill said, it's not going to be a good fit for everybody. We had cases, I can recall one specific scenario that happened a few years ago with a patient that said, I'm going to write you a check. It was like a $9,000 treatment plan. And she said, I'm going to write you a check. But we didn't accept her for care because myself and one of my colleagues in my practice, we didn't feel like she's going to follow our instructions, right? And so we just told her, listen, we're here. When you are committed to this, we'll need at least 6 months of working with you. When you are, come back and we'll start working together. So the problem is not the money. A lot of practitioners think, oh, it's the money. This is what patients are not going to pay $300 or $500, or that's not the problem. Our challenge is to communicate better. We're going to talk about the system on how you do that, right? How you operate your practice. And then that's something we'll help you put together. You don't need to reinvent the wheel, right? That's already developed for you. But the most important thing is to make sure that we're not judging a person if they can afford it, or if they come up with that money or not, or they're close. I used to do that all the time. And what my mentor used to tell me is, your job is to educate them about the options, right? It's up to them to decide how they want to proceed, right? And when I did, I found that way that I can get the transformation, or get them closer to the transformation they're looking for. So as Dr. Chill mentioned, what we want you to focus on is how you can deliver the best value for their money, how you can deliver them the best results you can possibly can. And of course, are they a good fit for you? If they're not, you just let them know. But if they are a good fit and they're there, they want to work with you, then you need to proceed, not judge them about what they can afford and they can't afford, and they would pay and they wouldn't pay. Like, that's not up to us, right? That's up to them.
And if you have a good system, right, the system will actually vet who is a good potential client or a good potential patient for you. So you don't have to do any of that sales stuff, right? We have technology that can do all of this. And both Dr. Cohen and I have already done all of the systems. We've done a lot of trial and error to figure out what works, what doesn't. We've created multiple systems. We've integrated multiple systems, right? And we figured out which systems work. And so you don't have to go and do all of that. when they actually book a discovery call or a free 15-minute consult with you, they're already ready to go. They're ready to get into your program. They're ready to jump into your one-on-one session. They're ready to get into your package, whatever you're offering.
Exactly. The secret sauce is, one, you got to have a recipe that is proven. That's really important. Have systems in place and let technology do the work for you, right? And so let's go into that so we can show you what it looks like. So this is the system. Let's say this is the machine that helps you bring from patients in to the end result, which is, you can see here, that's the profit. So you're profiting $200 to $800 per session, right? So if you have 3 sessions a day, that's about 3 hours. You make, let's say, $600, right? Once you grow your practice and you bring in 10 a week, you're going to make $2,000 a week, right? That's just as an example of what it is. When you're at the level of Gina, right? Gina is already charging $800 a session, right? And her problem is not the income. She's making really good money, right? If you think about 6 sessions a day or 7, $800 a session, that's a really good income. You know, now she's at the level of, I want more freedom. I want to help more patients. So that's how we're now training 3 more practitioners to help her. But we want happy clients. We want satisfied clients. That's really important to know that you're making a difference in the world. It's also important for your reputation, right? So let's talk about how this works. So there's more. We need patients in, right? So there's 3 major ways that we're going to get patients in. I love the free marketing. So that's something that I teach a lot. So we have workshops when I teach this, the free marketing. So essentially, how do I get patients into my schedule without spending any money? And when I say any money, I mean like nothing, like $0 to get people in and turn them into clients or patients that are actually paying you, right? So there's like 5 different methods that my mentors taught me. I paid dozens of thousands of dollars for mentorship to learn those systems. We teach you that. So if you're interested in that, we teach that, how to do free marketing. Now, if you have a virtual practice or you have any brick and mortar and you don't want to bring your patients in using free marketing, then we can do something else. So we can do, for example, there's social media management. So social media management, Dr. Chill, you want to talk a little bit about what that is?
Yes, absolutely. So with social media management, right, there's what you do with posting into all of the different social media avenues, right? It could be posting into your Instagram, your Facebook. A lot of practitioners stick with Facebook and Instagram right now because that's where the majority of our demographic is at. That's where the majority of our potential clients are at. And still, that's where the market is. And there are systems that can come into play where you can schedule out your posts. And what you're doing is educating the demographic, right? Your potential clients about who you are, who you serve, how you help, what you do, your credibility. It's really just information that you're posting about. And there's certain ways that you can do that hits the algorithm. And that's what social media management is. It actually allows you to get organic traffic from that area. So they go into this funnel system, right? They go into your landing page, your website, or your funnel system. They go in and start to watch your webinar if you're creating that. And then they learn more about you. And then they end up booking a call with you, whether it be a discovery call, your visit, or going into your programs. But the social media management portion is really managing all of the different posts that go into the different avenues of social media.
Yes. And so as Dr. Chill mentioned, right, this is a part of the health funnel. That's, let's call it that for sake of our conversation, the system. So social media management is really the consistent posting, and that's typically daily, of, as he mentioned, who you are, what it is that you do, who you serve, all of those. And there's like really, there's like very specific templates that are time tested. We know that they're working. We know for each specific, like if you want to focus on women's health, or you want to focus on diabetes or arthritis or IBS or whatever it is you want to focus on, there's like specific templates that we use, and those are done daily. Now, if you want to do it yourself, there are examples and posts that can do that for you, but there's also a service that we offer that it's like done for you, right? So you don't need to do it, it's done for you. So there's actually a social media expert that is sitting there every day and posting into your community, right? And inviting them to come into our funnel, essentially providing their contact information so we can continue the conversation, and all of this is done automatically, right? So if you want that service, you can reach out to us. We can provide that. And then the other form is ads. Ads are essentially going out to Facebook and paying Mark Zuckerberg to get us some leads. We call them leads, people that are interested in what it is that you're doing. Now, of course, we still need the system to do its job, the funnel, to make sure that the people that show up are the people that they're the right fit for you. They are going to pay cash for your services. They're ready to commit to working with you. They understand the value of what it is that you're doing. So that's another option. I would not necessarily recommend to start here, because this is ads are the most expensive way of doing marketing. I would recommend to start with some free marketing and then some social media management. That's what gets you fast results, really good results, and start filling up your schedule. So, Dr. Chill, let's talk about the first step. Those people are coming into your funnel, and the first part is educating them, right? So we have to educate our patients. So we have to educate them about the value of our services, right? Because as Dr. Chill mentioned, if they don't know who you are, how you can help them, how is your service different than another practitioner that will just give them a prescription and send them back home, they won't pay. The reason why they're paying you is because they developed a confidence and understanding that what you're offering is something completely different, right? Dr. Chill, you wanted to mention anything about this phase of
Yes, for the education portion, right? There's a couple of different ways that you can do this, and we go through the different variations on how you can educate them, so it almost becomes automated for you, right? I'm all about automation, so you don't have to constantly do this portion, and there's ways that you can automate this utilizing technology, so that technology is educating those potential clients for you. So when they come in from those different avenues, the advertising, the free marketing, the social media management, right? And as Dr. Cohen was saying, we really recommend kind of doing the free marketing and the social media management first, because it really helps you hone in on your messaging and your marketing messaging before you start to pay for it, because you don't want to test all of that information and pay for it, because it costs thousands and thousands of dollars. So a lot of practitioners that are starting out, we recommend kind of going that free marketing route and the social media management route first. And a lot of times there's practitioners that don't even need to go into the advertising because that's working for them. But that next step in the funnel is really to educate and building credibility for yourself. And there's different ways that you can do that.
Yes, absolutely. And I'm glad you mentioned that because ads would be the most expensive way of doing that. And I see a lot of practitioners spending money on it.
Hmm.
I definitely went through that mistake. I hired and fired 3 marketing companies, cost me thousands of dollars, and it just didn't deliver the results that I was looking for because a lot of those leads were just didn't qualify. They were not good. They were not a good fit for our
Right.
services. Free marketing is free, which is great. So you don't spend any money, right? Which is great. And you can fill up your schedule as doing that. Social media management, you can do it yourself. Like we have templates and all of that stuff, you can do it. But you can have somebody doing this for you, and it's not that expensive.
Hmm.
You can have somebody doing this for you like 7 days a week, and it's somebody that we already worked with, we have experience with, and then you can get leads, you can get people that are interested coming in to your funnel 24/7 basically. You can be at home over the weekend. This is the cool part. So when I was I remember times when I would be like over the weekend, you know, I would go watch a movie with my wife, or we do something fun over the weekend, or we'll be resting or whatever it is. And then on Monday, I'm showing up to the practice and we already have a list. We already have people on the schedule from the weekend that I was just resting. I wasn't even at work, right? So that's the cool part about the social media management is that it's done for you, so you don't have to do that. And then again, educating the value of your services, that's done automatically. Now, the next step is critical for them to spend money and trust you, right? And that's building the know, like, and trust factor, right? If they don't feel like they know, like, and trust you, they won't commit to working with you. At this point, it wouldn't be even about the money. It would just be simply they don't know who you are. They don't know what you're doing, right? And they definitely need to trust you. This is a really big one. So one of my mentors always used to tell me, you need at least 7 contacts, 7 contacts with your ideal client, right? Now you can those contacts could be anywhere, right? And think about it psychologically. The more you see somebody, let's say you see them at work, the more you see them in church, the more you see them whatever it is, the more you feel like you know them, right? The more you feel like you can trust them. Why? Because you see them more, right? And the more the conversation is talking to you and you feel like you're connecting with them, the better. So my mentor always used to say 7 contacts to build and know and like trust. Now, we already have templates, we have emails templates, we got SMS templates, we got all of that. And there's also technology that if you want to automate it, we have technology that can help you automate it. So then you don't have to do this manually. Like I used to actually call potential clients, talk to them a little bit for 5 to 10 minutes. I would send manual emails. Today there's technology, it does all of that for you. Again, you can be resting over the weekend while this system does it for you. But make sure always you have to contact patients. You have to provide some value before they spend some money, right? Dr. Chill, I know that this is something that you've put together for so many practitioners. So I wanted to also hear.
Yes, it's those regular touch points. So a lot of when you're starting in marketing and when you're starting your own practice, a lot of practitioners just think that they can just do like one post and then they're going to get a patient, right? And that's not the case at all. What we're seeing is you need a full-on system to educate them, not only educate them, but to have those regular touch points. So when they provide an email address, when they provide their contact information, you're touching up with them, you're contacting them, you're nourishing what's called nourishing that lead, right? That I call it a potential client. It's also called a lead. It's a potential patient. It's somebody that comes in from Facebook advertising, from free marketing, from social media management. They don't know anything about you. So they need to get to know you. And the way that you do that is to have those regular touch points. And technology can do that by creating automated workflows that send out regular emails, send out regular texts to them. And we have all of those templates that we know work, right, for those touch points. So now they're getting to know you. They're getting to know what you do, who you serve. They feel like they start to get to know you, right? You're building credibility with them at that point. But you need those regular touch points before they feel that.
Yes, absolutely. Thank you, Dr. Chill. And the next step, so these are all steps that we're taking them through, right? We're taking them from there. They're interested. They saw, maybe they heard about you, jumped into your website, maybe some free marketing or maybe social media management. We posted something and they got their interest. From there, we educate them about the value of your services, how it's different than standard of care, the insurance model. And then we utilize a minimum of 7 contacts. In my practice, it was more like 10 to 14. That builds the know, like, and trust, right? So we kind of getting them to this phase. This phase, they're already warmed up. They hear your name and they're like, oh, I heard, that sounds familiar. Like, I know that practitioner is doing this and is doing this. And like his approach is going to teach me about what's wrong with my body. They're going to give me some natural strategies to improve my health. Like now we're building that confident, right? From there, we in the system, or you can invite them to a consultation, right? Which means one-on-one, actually talking. Could be on the phone, on Zoom. There's if you want to do that. So it's a pro account. It's like $15 a month. It's not expensive. But or in person. If you have a brick and mortar, maybe in person. So you do the consultation. We teach you how to do the consultation. This is critical, and you definitely don't want to mess this up. Your first real connection with the patient will determine how long they're going to come to see you, how much they're going to invest time, effort, money, all of that stuff. That's very critical because that's your first impression, and it's really hard to undo a first impression. So learning what to say, how to say it, which questions to ask, how to lead them through the consultation. And then there is a different way to do that, which is a webinar. So if you want everything to be virtual, you want everything like automated, then Dr. Chill and myself have a webinar system that can also help you. If you want to do that, you can stick to the traditional consultations, but if you want to upgrade that, then we have a system for the webinar. And then from there, the evaluation and care, right? Providing evaluation and care, which is all recommendations, right? So how long would they need to see you? What would it take? And then from there, setting up the what care, right? So let's say the care plan, right? And then from there, they're coming to see you, they're paying, right? So this is essentially I oversimplified it, but what a lot of practitioners are doing, and Dr. Chill just talked about this, a lot of practitioners are meeting a patient and they're trying to skip all of this and go straight to, right? Patients walk in, oh, I heard you might be able to help me. Yes, let's see if we can help you. It is $300 or $150. And the patient is like, well, why would I pay that? I got my primary care here and it's like $30 copay, right? So Dr. Chill, this is something, I used to make this mistake, by the way. I'm not saying that any of you do, but I'm saying
we all have. We've all made that mistake in the beginning, right? That's why we went through all of these trial and errors to figure out what's actually working. And then having that system actually saves time, because that entire system is what vets your potential clients, your leads, right? It gets them warmed up. So when they actually book a discovery call with you, a free 15-minute consultation. Some practitioners charge for that consultation as well. They're ready to go. They're ready to jump into your program. They're ready to jump into your visits.
You know, one of the things that I just hated so much was having a consultation, and I would sit with a patient, and I can even see those faces of those patients in the first 5 years when I was in my practice. And some of them would just be so upset that they went from one practitioner to the other, and one of them was on biological medications for arthritis, which was costing her thousands of dollars every year. And they were so frustrated with the pain, with the struggle. And some of them were crying and telling me all about, and I was like, well, let's do this. I mean, here we got this, we got this evaluation, we got this system. Let's just do it. It's going to cost you $200. We're going to sit with you for an hour. And then they would book a next session, and then they wouldn't show up, right? And it was for me because it wasn't just the loss of money, right? The loss of revenue to my practice or money for myself and my family. It was the opportunity to help those people. And I knew the power of what these systems and approaches can do for them, right? And because I would see other patients do so well, and I would see myself completely transform my own health, and I would be like, that is such. It was almost like I would feel a little pinch when when I look at my schedule, or my receptionist would say, oh, so and so, they canceled today, or they didn't show up, and I'm like why? Because we could have helped them. We could have helped them so much. I know they're at home right now struggling, right? So the main reason that I took my mentor is not just to grow my practice, but I knew that it is my commitment and my obligation to help as many patients that I can out there, right? And so learn how to do this right. Don't try to skip. Don't try to take shortcuts. Like, if you're doing this, if you're helping patients, you're building a consultation practice, my recommendation is to do it the right way. Have a system. You don't have to have everything. But again, if you choose to, we have systems. We can just give you the system. If you want to, we can show you, we can teach you, we can even give you the system. You want to upgrade, you want somebody to do that for you, great. You want to upgrade, you want somebody to build your website, to do the social media management for you, to get people in, to help you build the webinar that runs automatically 24/7 for you online. Great. You want an automatic scheduler just showing up and patient schedule with you? Great. We have that. We have those options. But think about, this is the biggest investment you're going to make, and this is going to be one of the most profitable potentially things you can have in your life, exactly like Rose, Suzanne, Gina. We got so many testimonials from practitioners who are talking about their patients. They're talking about their own lives, how they transformed. So do this the right way. We wanted to show this because it's a system that we developed. And of course, this is the system that helped me going from barely paying rent, $650 a month, to getting close to $2 million revenue per year. And I'm not showing you this to brag. I mean, it was a lot of work, but I could have never done that. I would probably get stuck at $65K a month, pay a receptionist, and not much left in the end of the month for myself, right? If it wasn't for my mentor and a system and systems, it's the systems and automation that gives you freedom, and it's the mentor that gives you the guidance to be successful, right? And you can be successful. You don't have to have a team of, 5, 10, or 15. You can be yourself with your skills, your unique experience, and we're just adding on those protocols, those tools, learning the mechanisms of functional medicine, right? We got mentors like Dr. Esha and Kim. Kim is also a nurse that went through our program, opened up a practice. Now she's one of our coaches. Dr. Chill is amazing. So we can help you get there. And then our program, as I mentioned, it's self-paced, 100% online. No need to travel anywhere. You can study from home. We give you all the tools. We go in depth into the functional lab analysis, right? Teach you how to look at that, how to review that, how to use all the treatment protocols. We got clinical guides specifically made for you. And of course, this month we got our special yearly promo, which is we're offering $3,000 scholarship and the phone app. So all the treatment protocols, you get the phone app as well, which will save you a couple of thousands of dollars at least. And then you get the lab analysis, all of that stuff. So we got a lot of really cool stuff coming up. And of course, as I mentioned, right, the mentorship is critical here. So Dr. Chill, anything else that you wanted to mention?
I think that's the biggest thing is the correct mentorship, right? And the correct systems. Because if you have a good mentor that's already done all of the trials and the errors, they've created all of the systems, take those systems. You don't have to reinvent the wheel. And it literally gives you that boost to get to where you want so much faster. I know for Dr. Cohen and I, it took us years and years of doing that. And that's how we created these systems.
Yes, absolutely. It took me years just to figure out what to put on my website, how to do it, what to put in my email, what works, what doesn't work, right? And we spent thousands of dollars on just trial and error. And so we don't want you to go through that. We want you to be successful. Exactly. I mean, Dr. Chill is literally giving you, if you want, and now, if you want just the practice building, like you're already doing functional medicine, you want the practice building, we have that. Like we have this whole system that I was talking about here in the, you can see it here in the, on the board, like this whole system together with a website, together with hosting, together with HIPAA compliant email and SMS, like HIPAA compliant, not MailChimp or all of that stuff, right? Like HIPAA compliant, do it, right? We have all those systems that are HIPAA compliant. They're ready. They're already loaded up with the strategies, the emails, the landing pages, the SMSs, the automatic scheduler with Dr. Chill's coaching. So if you want just the practice building, no problem. We have that. It's a simple monthly payment. You can reach out to us if you want additional information. If you want somebody else to do the marketing for you, no problem. We got that as well, right? We got the do it for you options as well. So you can reach out to us, and we'll get when I'm saying that within, like you can wake up 3 months or 4 or 6 months from now, and you have your own practice. It could be part-time, bringing you additional $1,000, $2,000, $3,000 a week or $10,000 a month. It could be, 2 days, 3 days. It could be full-time. It's up to you. I mean, it's your life. You get to design your life the way that you want it, right? So now you know that we have all the tools to help you. So I really want to thank Dr. Chill for being here, sharing his experience with us. And Dr. Chill is our lead mentor when it comes to the practice building. And we also have other clinical mentors like Dr. Esha, who have years of clinical experience with functional medicine. They're going to help you to do case studies as well and show you how to use the protocols and all of that stuff, build a successful practice. And then Kim is another one of our coaches, which I highly recommend for nurses to work with Kim. Kim has been training nurses as a professor in one of the universities for the last 15 years. So she's very, very good at what she does. And she also took She took our systems and strategies, and she also built her own private practice. So we'll be happy to connect you with Kim as well. So I want to thank all of you for being here. Dr. Chill, thank you again.
Thanks for having me. It's a pleasure.
And we are going to open the application. So the next step is, Jacob, can you go back into the slide? So the next step is to put in an application. Jacob has posted in the chat the link for the application where you can read more about the program. There's a little video explaining about what's included. And then from there, you can, if it's a good fit for you, put in an application. This is only for healthcare practitioners. So you have to be a registered nurse practitioner. You have to be a pharmacist or a PA. You have to be a healthcare provider to get into this program because it is very advanced. It's not it's not open to the public, the general public, right? But we'll show you how to do coaching. We'll show you how to do the holistic approach and the clinical side of it. It's all included for you. If there's any questions, please post it in the chat right now. And then I wanted to just say that I'm really grateful for all of you for being here. I know that this was a little bit longer than we initially planned it to be, but I really wanted to show you the systems and how Dr. Chill and myself have helped a lot of practitioners to do this. And in the link that can you post the link again? There's some more information about this program. And if you just want the Practice Accelerator program, there's like two different options, and the guidance and the mentorship. And then we also have live classes that we help you every time to build functional medicine and build your practice. And then there's also an option for that includes the done for you social media management. So somebody actually posting for you every day, somebody who's trained in social media, that's their expertise, right? They don't do medical stuff like you do. They don't do functional health coaching like you do. They only do social media management. So that's what they do best. And that's another option. So schedule a call with us and we'll be happy to reach out to us. We'll be happy to help you see which option might be better for you. There's different pricing for different options, but we're going to make it as affordable as possible because we know the practitioners just like you are just starting. It's definitely not going to be what I paid my mentor, which is $12,000. And I still had to do a lot of the work myself. Right here, you have options for completely done for you, right? So that's awesome. I mean, if somebody would have told me that when I first started, I'd be like, hey, we're going to build you a website with proven strategies. We're going to build you a system that is HIPAA compliant, that does all the heavy work for you, reaches out, build trust, and contact your ideal patient multiple times, educate them through an automated webinar, and also give you all of those guides on how to do it properly. I mean, it's mind-blowing. I wish I had that back then, because I got my mentor for $12,000, which was tremendous investment. It paid off 10 times, right? But now that you get this system with everything automated, that's incredible in my opinion for a lot less than that, right? So our functional medicine program is $12,950, but there's $3,000 scholarship right now. So that's a little bit less than, I think it's like $9,950. And then if you want the Practice Accelerator, just the Practice Accelerator, just reach out to us because there's 3 different pricing for that. And we can help you. Literally, one of these options are starting from $450 a month if you want to. So we're going to make it affordable for you. We just need to know that you're committed. You want to get this going. You want to help patients. You want to be successful. Again, that's the most important part, right? You're going to be a good fit for us if you are committed to developing your own private consultation practice, you want to help patients, that's really what we're looking for, right? Like Dr. Chill and myself, we'll spend a lot of time with each one, and we, beyond the group sessions, we also have one-on-one, we also have recorded classes, but a lot of the strategies we do one-on-one, and we want to make sure that you are committed because we're spending a lot of our time and effort as well. So again, I want to thank Dr. Chill for being here, and I really appreciate it. I want to thank our media team and Jacob for allowing us to connect with you. I want to thank our other mentors, Dr. Esha and Kim, for being a part of our community and a part of mentors. And I want to thank each one of you for being here, for being the guiding light for your community, and showing them a path, a different path towards better health and function. They can't do it. Just no other words that I can say. They just can't do it without you. So let's take a look at the chat real quick. So, is there a link for done for you social media management? So right now, the accelerator program, can you put our email, Jacob, the contact at? Okay, perfect. So Jacob is putting our email, and we're going to send out some more more specifically about the Practice Accelerator for all of you who are interested. There's going to be some information about the different options if you want the systems and the mentorship all together, or if you want it also the done for you. So we're going to give you different options, and then you can kind of decide what works best for you. And again, if you got questions, there's going to be a link to book a call with us so we can help you get started and start turning on this system, right? Getting more people in to book with you, and we'll teach you how to do the consultations and all of that stuff. So I really appreciate each one of you. Thank you for taking the time for being here. To understand more about the scope, what's the flow of the functional medicine, how you should design it in your practice, and then again, some of the marketing foundations, right, for that. So I really appreciate each one of you. Thank you for being here, and I'm looking forward to working with you, and Dr. Chill as well. I know Dr. Chill loves working with practitioners. That's really what he does most of the time now, after building like 3 or 4 different practices and programs and all of that. So
yes, it's definitely now my mission to help practitioners get there a lot faster than I did.
Yes, absolutely. So thank you again for being here. Have a good evening. Take care of yourself, and we're looking forward to working with you. Take care for now.